Welcome back. You're still tuned into Business Lunch. An important story now, a probe report by the top public health body of the US, the Center for Disease Control, into cough syrup deaths in the Gambia has pinned blame on Indian manufacturer Maiden Pharmaceuticals. Ekta standing by at the big wall with all of the details on the story. Ekta.
Well, thanks for that. The US Center for Disease Control has linked the death of at least 70 children last year to medicines contaminated with diethylene glycol and ethylene glycol. The report suggests the cough syrups were likely to be manufactured by Indian Company Maiden Pharma that were imported into Gambia, causing acute kidney injury cases among the children. The Indian government has given a clean chit to Maiden Pharma in December last year. The US CDC report follows a report by a government panel in Gambia in December last year that recommended prosecution of the Indian manufacturer of the cough syrups. The WHO, remember, had issued an alert in October of last year advising regulators to stop the sale of syrups. In what highlights the possible linkage to Maiden Pharma, the US CDC in their report says that all the caregivers interviewed had reported that the child in their care had consumed a prescription or over-the-counter syrup-based medication. And while many caregivers they interviewed were unable to recall the names of medications that they were administered, a single international manufacturer that produced a syrup-based medication was reported by 8 of the 14 caregivers in question. Further on, the lab analysis of 23 medication samples conducted by Gambia's Ministry of Health and WHO confirmed that 4 products from Maiden Pharma contained DEG and EG, and all medications that had tested positive from the substance were imported into the Gambia on June 21st of last year, shortly before the occurrence of the first case of acute kidney injury. Now, the CDC says that this was one of the first documented DEG outbreaks in which contaminated medicines were in fact imported. It aims to point to a larger concern of DEG mass poisoning continuing to occur globally, especially in low-resource settings. For example, such cases have been documented in Panama, Nigeria, India, and Haiti. In the past, manufacturers have been suspected of substituting DEG in place of safer but more expensive pharma-grade solvents. According to the US CDC, these DEG-associated large-scale poisoning events can be strengthened via international regulatory structures in place in the pharmaceutical industry and surveillance systems that could be, in fact, event-based.